Hello everyone, I am Dr. Sufia, Specialist Obstetrics and Gynecology at Hamad Medical Corporation, Qatar. Today I'll be addressing my topic, addressing women's need for contraception in Qatar by educating them, an initiative worthwhile. First of all, before I commence, greetings from Qatar. I do not have any conflict of interest or disclosure in relation to this presentation. So what are the learning objectives that will be addressed in my presentation? First, patient awareness and need for contraception, benefits of postnatal patient education, a brief discussion about our project, and overall patient experience after the project. So let's see, why do women need contraception? It's just not a way of birth control, but studies till date have revealed that inter-pregnancy interval less than 18 months have been associated with adverse outcomes for both mother and the child. Inter-pregnancy interval below 18 months is associated with increased risk of uterine rupture, uteroplacental bleeding disorders like placental abruption and placenta previa. Postpartum contraception has shown to reduce unintended pregnancies and optimize the interpregnancy interval. Interpregnancy interval less than 6 months also increases the risk of low birth weight and preterm birth for the baby. That is why American College of Obstetrics and Gynecology recommends the initiation of immediate postpartum contraception before leaving the hospital. However, this is not practiced by most of the hospitals. If we look at this graph, we can clearly see that how a decrease in the inter-pregnancy interval leads to increase in the low birth weight, and the results are statistically significant if this decrease is less than a year and even more if it is less than 6 months. This graph shows the risk of placental abruption, and this also shows an inverse relationship between interpregnancy interval and increased risk of placental abruption. Another graph from a study shows that prevalence of autistic disorders in children also increases exponentially with decreased interpregnancy interval. This is the geographic distribution revealing the use of contraception by women worldwide by United Nations. And according to this data, in Qatar, around 43.5% of women use one type of contraceptive method. So, what are the challenges that are faced by postnatal patients? If we ask a mother, what do you need after your delivery? Most of them will happily say, absolutely nothing. But that is not the case. The fear and the anxieties that will prevail later, nobody is essentially aware at the time of childbirth. And that is how the problems commence. All these women, they lack detailed postnatal patient education. All the misconceptions that they have regarding contraceptions are usually not addressed. The lack of awareness about breastfeeding and the need for continuation of that is not very clear in their minds. The partners usually do not participate in the contraceptive counselings and are not aware about the needs of a woman. And most of the physicians, they do not have a full postnatal follow-up after the delivery. Most of these women are seen in health centers. And unplanned pregnancy usually occurs because of the delays that are there during the postnatal contraceptive period. After childbirth, a mother feels like a princess and she feels she is in heaven with that pleasure she feels with a baby. She feels the life is like a bed of roses. But when she addresses the practical aspect of motherhood, the negative emotions set in. And if they are not addressed in time, it can affect on her health, on her baby's health, and on her families as a whole. And it will have a very negative impact on all of these if not addressed. Here comes the benefit of postnatal education. It increases the mother's awareness on benefits of breastfeeding, awareness of contraception to space her pregnancy. Maternal nutrition help her to take care of herself, which indirectly affects her baby and her family, and increased awareness leads to increase in her compliance to follow these things. So we conducted an audit at our hospital to assess the status of contraception usage in women delivering in our hospital, and we found that those women who delivered and were counseled in our clinic, 43% of the pregnancies were unplanned, 29% of the patients had inter-pregnancy interval less than 18 months, and 25% of these conceived within 6 months. 75% of these conceived within an year. Only 4% of patients had adequate awareness of knowledge about contraception. 73% had little or wrong information, and 23% had no information at all. So this is a graph showing what I have just spoken. So our aim was to maintain inter-pregnancy interval for a healthy mother and a healthy child. So the project was started keeping all these facts in mind at our department, and it was supervised by the head of obstetrics and gynecology and pharmacy, and patient education was basically focused to implement our aims. It was initiated basically with the aim of educating the mothers regarding complete knowledge about contraception, breastfeeding and maternal nutrition. Patients were educated through detailed information was given on contraceptive methods which are available in Qatar. The patients were educated regarding the need to maintain the inter-pregnancy interval to promote maternal and neonatal health in future. And these women were followed after 6 months and 18 months of their discharge from the hospital through telephonic conversation, and the CERN records were evaluated. This was the first of its kind project in our country to implement safe motherhood and childhood. The targets of the project or key performance indicators of a project were to promote contraceptive use, to increase inter-pregnancy interval, improve breastfeeding practices and its continuity for more than 6 months after delivery, increase awareness amongst patients, and to increase inter-pregnancy interval of more than 18 months. That was the main aim of our project. This project was initiated by a dedicated team of pharmacists, nurses, and physician obstetrics and gynecology at our hospital. And before starting our service, the most recent guidelines in recommendation to our Supreme Council of Health and its national health strategies were looked into and implemented. All postnatal patients in the ward were approached by a dedicated nurse. Patients willing to attend the services were provided with a time allocation. Patients were then brought individually by the nurse to the counseling room, and patients were counseled and educated about family planning methods, breastfeeding and nutrition in detail. And all their queries, questions, misconceptions were addressed. Partners were also allowed to participate wherever the patients asked for it. So the main principles were to give one-to-one counseling to the mothers, to make it a patient-centered conversation, language preferences were addressed, and involvement of partner was also encouraged. So let's have a look at our result. This graph shows the number of patients counseled over 2018 and 2019. As I already discussed, 43% of pregnancy in this group of population was unplanned, and only 4% of the patient had knowledge about contraceptive methods. So let's have a look what were the misconceptions regarding contraception. Most of the women feel that the contraception should not be used because it has major side effects. 65% of the women were from this category. 15% of the women believe that it has high failure rates, so better not to use it. 11% thought it will cause menstrual disorders, and they already have menstrual disorders in their postnatal period, so that had a hindrance in their mind to use contraception after delivery. And 9% of the women believe that it can cause ovarian cancer. As a result of good counseling, 76% of the women accepted one of the contraceptive methods at the time of discharge, while 24% of the patients were not sure which one to use and decided to have a postnatal follow-up at 6 weeks to further commence it. If we look at the parity distribution in our study population, around 32% of the women were primi gravida and 68% were para more or equal to 1. This graph depicts the improvement in breastfeeding continuity even after 6 months of delivery. As you can see that only 12% of women practice continuation of breastfeeding after 6 months before our project, and we achieved 47.6% women to continue breastfeeding even more than 6 months, and some of these women also continued till 1 year. Looking at this chart, you can see the interpregnancy intervals of less than 18 months before counseling in our hospital was around 29%. However, after counseling, we brought it almost to less than half, which was 12% in women after counseling. So let's have a look at the goals achieved. We achieved patient awareness. 2030 patients were counseled in this project. Patients' interaction was addressed. Patients' convenience was addressed. Patient satisfaction was achieved. And exclusive breastfeeding was achieved in 47.6% patients. Interpregnancy interval of more than 18 months was achieved in 88% of patients. This chart is revealing a comparative analysis of our results before and after counseling. As you can see that knowledge about contraceptive methods and breastfeeding, which was there only in 40% of women, increased to 100%. Contraceptive use, which was used only by 35% women, increased to 76%. Breastfeeding from 12 to 47.6%, and interpregnancy interval from 71%, which was more than 18 months, increased to 88% after the postnatal counseling. So let's have a look at overall patient experience. We did a patient satisfaction survey to assess that how happy they were after our postnatal counseling, and we included all those points which are relevant to our counseling methods, our attitude, and the overall patient experience. And we were happy to find that most of our women after postnatal counseling strongly agreed that the communication was clear, attitude of health provider was appropriate, the nurse was cordial and cooperative, all the questions of the women were answered, healthcare provider listened carefully, they were able to choose their options without any concerns, all possible side effects of family planning were explained to the patient, the healthcare provider was knowledgeable, the room where the counseling session took place was appropriate, and the services were confidential. Counseling before leaving the hospital was better for them rather than having it later or after discharge. The overall performance of healthcare provider, it exceeded their expectation or not, and whether they were familiar about all those methods that we use for contraceptive counseling, or they were still not very well sure about it, and whether they feel comfortable with the service and they would recommend it to their family and friends. And we were happy to find that around 70 to 80% and more than 80% women strongly agreed that they were happy, and the overall patient satisfaction survey revealed that the patient had a very good experience after our project. This chart just shows how the challenges faced by the patients before counseling were addressed by our project and made them happy, giving them an excellent patient experience with our project. So the aim of this project was not just to have a healthy mother and a healthy baby, but also to have a healthy community. At Hamad Medical Corporation, we aim and we are focused for quality and safety for our patient. Patient experience matters a lot for us, and that is why we are aiming for very good quality of care for our patients, including their safety, and that is what guides everything that we do at our institute. Thanks a lot for your patient listening. Thank you.